You're listening to C103's Cork Today podcast. Phone and text lines are currently closed.
C103.
And we're off to the Health Hub Times Square in Ballincollig, where Anneliese Dressel joins me on this Monday afternoon. Good afternoon, Anneliese.
Good afternoon, Patricia.
And you're very welcome. Okay, lots of questions. Let's see if we can get through as many of them as possible. Starting off with a North Cork listener. Question for Anneliese, please. My son's breath is very bad. Now, he brushes his teeth at least 3 times a day. He's using mouthwash. We've tried all different types of toothbrushes. He's brushing his tongue morning and evening. But sometimes, even immediately after brushing, I can smell his breath. He's 16, so he's now starting to become conscious of it. And my fear is that somebody might say something to him. He takes mouth spray with him. He's constantly chewing sugar-free gum to try to mask the smell. I have an appointment for him to see a dentist soon, but he doesn't have any decay or any fillings. Nothing wrong with his teeth on the last visit, so I don't think it's a tooth problem.
Yes, I don't think it's coming from his mouth at all, Patricia. I'd imagine that's coming from his stomach. It's quite common that if you have bad gut bacteria or if your digestion isn't working, you could get that coming up from your stomach. So the first thing I would suggest is taking a probiotic. And there's a very nice one that actually you can suck as a lozenge, so it's very good for the health of the mouth as well. And that's the Udo's Super 5 lozenges. So that will help in terms of the mouth and putting the good bacteria in. The second thing that might be worth trying, when I think of teenagers with kind of skin problems, breath problems, digestive issues, Patricia, they're all taking that whey protein. And if you've got a dairy intolerance, whey protein is actually the worst way you can take dairy because it's actually the protein element of dairy that you're reacting to, and that's super concentrated in whey. And I have young boys and girls coming in saying, I've broken out in spots, I don't know what it is, and I say, give up the whey protein, and a lot of the time spots will clear up. So I don't know if maybe he's taking a lot of whey for working out, but I think maybe that could be causing digestive issues, which could be linked to this smell. So that will be one thing maybe to cut out. If he does need to take protein, it can be replaced with a plant-based protein, which is actually much probably easier to digest even. But then maybe taking something like a digestive enzyme or even peppermint oil is another very good thing for the digestion, and you can get that in capsules. Some digestive enzymes, for example, the Quest is the name of the brand. Quest digestive enzyme, they actually have peppermint in there as well. So something like that to help from the stomach, and then the probiotic to suck, which will help with the bacteria in the mouth, but also will help with the bacteria in the gut as well.
Those lozenges are brilliant if you suffer from mouth ulcers.
Fantastic. They're
brilliant.
Really, really good. Or if you've got thrush as well.
Yeah,
in your mouth.
They're excellent. Eileen is out on Bear Island. She's on blood pressure medication because she suffers from high blood pressure. Is there anything that you would recommend for her to boost her energy that wouldn't interfere with the blood pressure medication?
Yes, so I think this is a difficult one, Patricia, because there are things that will boost your energy in the very, very short term. And that would be things like ginseng and guarana. And these, when they're taken in the long time, can affect your blood pressure and can increase blood pressure. So they're not good. Generally, with natural, what you're trying to do is you're actually trying to work out what the source of the tiredness and the problem is, and you work at that root level. So generally, when I hear low energy, it could be post-viral fatigue. And if that's the case, you need to probably take a good tonic for a couple of months, like the Source of Life Gold. Now, there is a little bit of ginseng in there, but not enough that it'll affect your blood pressure, so don't worry about that. The second thing it could be low iron, or low B12, or low folate. And a blood test would show these. So if you've had those in the past, there'd be no harm taking an iron supplement like something like Nature's Plus. Hemaplex is a great one because it's got everything in there to produce healthy red blood cells to carry oxygen and oxygenate your whole cells and body. The third thing that it could be thyroid. And some people who are on thyroid medication, they still don't get a reprieve from the tiredness symptoms, Patricia, and I think that's where the issue is actually conversion. So they've got the thyroid hormone, whether it's they're making it themselves or whether or not if you're taking it in the medication, but when it can't be converted in the cell to the active form. And there's something very good for conversion, and it's called gum Google, G-U-M, like chewing gum, and Google, G-U-G-G-A-L. And Nutri-Advanced do a product called ThyroConvert, and that's got that plus a few extra things like selenium. that help convert the thyroid hormone that you take either in medicine form or that you produce into the active forms that drive our energy and cells. So try and see, can you figure out, is it any of those ones, and work at the source level.
Okay, Mary in Rossmore says, any recommendations on how to treat vestibular migraines? They're migraines are linked to vertigo.
That's right, Patricia. And unfortunately, there is a clinic, a physiotherapy clinic down in Middleton, that do specialise in treating vestibular migraine and vertigo. So you would go to them for a few physiotherapy sessions, and they will give you exercises to do. It's very hard to find a supplement that actually works for that. Sometimes it can be as a result of post-viral, so a virus can actually affect the canals of the inner ear, and they interfere with the way that you have balance. And that's where vestibular migraines can be kicked off as well. And there used to be a great supplement that was a combination of these things. So there was, what we do here is we try and cobble it together with a supplement called One Nutrition's P4 Immune, and that's got really powerful anti-inflammatory antioxidants in there. And then we recommend rosemary tea because the rosmarinic acid is very good for the inner ear. And the last thing is a probiotic with a bacteria in there called Lactobacillus salivarius. So if you think of the mouth and saliva, that's the one you're looking for. And that used to be in an old supplement that we sold that was very, very good for that type of thing. So you could try combination of those things together, but I think really you do need the physio is your best chance of getting reprieve from that.
Okay, hi, the Anneliese. I had successful surgery on a hernia about a month ago. All good, thank God. But in the last week, I'm suffering a lot of gas and flatulence. Is that linked?
So it could be, Patricia. Sometimes, like when you have surgery on your digestive system, it can disrupt, I suppose, the way your digestive system works. Sometimes, if it's been a surgery as well, they might use a lot of antiseptics that maybe wipe out some of the good bacteria. So it's actually no harm to take something like a probiotic after surgery on the gut, or if you have a colonoscopy or even a gastroscopy, because I do think things get a little bit turned on their head. So in this case, what I think you could take would be a gut healing supplement, because that would help with the whole healing from mouth to bottom, and all the bits in between, called, it's by Nature's Plus, and it's called GI Nutra, Nutra. And in there, it's got gut healing stuff, it's got the good probiotics, it's got digestive enzymes, and it's got all of the nutrients that are required for your digestion and your gallbladder and everything else to be working properly. So I think try something like that and do a month of it, and you should be reset back to normal.
Now, here's an interesting one about vitamin B supplements from Tim. I was taking a vitamin B supplement in tablet form, however, of late. I'm going to bed about normal time and then waking up at 4 a.m, wide awake, ready for the day. At my last checkup, my doctor said I had enough vitamin D, but to continue the supplements if I wished. Now I'm wondering, was I overdoing the vitamin B, because I've noticed when I've stopped taking the vitamin B, my sleep pattern seems to be going back to normal. Can you take too much vitamin B?
Yes, you might do, Patricia, definitely. Like, I've seen people react to all sorts of things over the years here, so I'm never surprised. It technically shouldn't keep you awake, because the B vitamins are involved in your energy pathways. So basically they stand in wait for when your muscles and all your other cells need to produce energy, and then they contribute to the process of producing energy. So it's not like taking something like ginseng or caffeine that is forcing you to, is increasing all your adrenaline and everything to keep you awake. So it shouldn't cause problems with sleeping, but if that person has stopped taking it and they're sleeping again, the only way to know is try and take it again.
And see.
And see. But I would suggest as well, take the B vitamin always in the morning, because you want it to work throughout the day. You don't really need it at night time when you're asleep. So that might help if he does need to take it. Some people have to take a B complex all the time for the B12 and folate. So take it after your brekkie in the morning, and it'll work throughout the day, and it'll be well gone out of your system at night time.
Mary wants to know, what would you recommend for very painful joints and muscle pain, especially first thing in the morning? Mary is on a blood pressure, cholesterol and an aspirin tablet. Would you recommend magnesium, and which magnesium would be suitable?
Okay, so the joints and muscle pain are kind of different, Patricia. Joint pain can often come from the wear and tear of cartilage, so that will be one supplement. And the two that we get great feedback on are the Gal-U C2 cartilage and the One Nutrition joint factor. So they are specifically to help build cartilage and joint. Muscle pain then could be, this is where I'm picking up on the fact that this person is on a cholesterol tablet. This is very, very common. And muscle pain can sometimes lead to joint pain. So this is probably where I'd go first with this. Taking a statin, it actually blocks the pathway in your liver that makes cholesterol, but that pathway also makes a vitamin called coenzyme Q10, which is completely essential for your energy pathways in your muscle cells. So people sometimes get side effects from the statin, like muscle pain, muscle atrophy either as well, Patricia, where they actually start, they start degrading muscles. Some people would notice that they've got, back pain, pain across the top of their shoulders, their arms, they're painful when they lift their arms, and also maybe short-term, feeling a bit forgetful and feeling fatigued. So if that sounds more like it, take the coenzyme Q10, 150 milligrams, a nice high-strength one. Take it for a month or two and see do all of those clear up. And if they do, then great. You know the side effect of the statin, so you can continue to take the coenzyme Q10. And if it doesn't, then maybe think about magnesium and the joint stuff for muscle and joint pain.
Okay, and very finally, we've about a minute and a half left. Louise is having a problem in that she feels her HRT isn't working. She's a lot of bloating, a lot of hot flushes. She's had her womb removed. She's on tablets for the flushes, but they're not working either. What would you suggest?
So HRT doesn't always work for everybody. I mean, the first thing I would suggest is that you need to give it at least 3 months before you know whether it's going to work for you or not. And then for some people, they find that actually supplementing their HRT with natural plant-based hormones work very well. And the one that I can highly recommend and that works the best for most of our customers, we sell lots of it, is the Nutri-Advanced Perimenopause Support. And there's stuff in there for the hot flushes, for plant-based hormone support, but lots more as well, Patricia. So it kind of is a full holistic approach to all the problems that come with menopause, and we get great feedback on that. So take that for a month or two, maybe even alongside your HRT, and see does that improve your symptoms.
Okay, that's where we leave it. Thank you for that, Anneliese.
Thanks,
have
Patricia.
a lovely week. And Anneliese will put up all of the items that she mentioned today, all of the advice that she gave. She puts it up on her own website later on this afternoon. Just give her a chance to do it. It's healthhubstore.com. And then John Paul will also put it up as a separate podcast on c103.ie or wherever you get your podcasts from.